Now at 4:30, February is American Heart Month, and high blood pressure could be putting your heart at risk. The number of adults with high blood pressure has gone up during the pandemic, as you can imagine. With us this afternoon to discuss it all, Minute Clinic nurse practitioner Jenelle Digianvittorio. Jenelle, thank you so much for being with us.
Thank you for having me.
So first, let's talk about blood pressure going up during the pandemic. I said I was not too surprised by that. Why is it
Yes.
important to continually monitor your blood pressure, and how often should you do so?
Great. So it is important to monitor your blood pressure. High blood pressure, as we're seeing, puts you at increased risk for heart disease and stroke, the two leading causes of death in the United States. The American Heart Association estimates that 50% of adults have high blood pressure. So it is important to know your numbers, get it checked at routine visits, and if it's at all elevated, address that.
In what ways do you think COVID-19 or the pandemic has affected our heart health? Obviously, it's easy to imagine this has been a more stressful time, but are there other symptoms that could be coming because of what we've been dealing with over the last 2 years or so?
So with COVID-19 and the pandemic, it's obviously changed our stress level, and it's in turn changed our lifestyles a lot. So we've seen decrease in exercise or physical activity, increased or changes in diet, increase in salt intake, fat, saturated fat, and cholesterol foods, as well as alcohol consumption and lack of regular routine health care, that people are either missing appointments or appointments are getting canceled, unfortunately.
For anyone watching right now, who is most at risk of heart disease? Who should be really paying close attention to their blood pressure?
Yes, great question. So blood pressure affects men and women equally, but they have shown that women are actually at increased risk related to the pandemic, perhaps because of stress, balancing that work-life balance, childcare, just the unprecedented changes with our health habits as well.
And what can you do to reduce your risk? What can you do to lower that blood pressure?
Great question. So if you have high blood pressure, definitely follow up with your doctor, take your medications as prescribed. But lifestyle modifications that you can incorporate are get exercise, get up, move around, avoid those unhealthy snacking that we've been doing at home. Those are those high salt, high cholesterol, and high saturated fat foods. Decrease alcohol consumption, and of course, decrease stress in any way that works for your lifestyle.
I know also that heart disease shows different symptoms in women and men. What exactly are they?
Great question. So men and women can present with those typical heart symptoms: chest pain, tightness, discomfort. But women in particular can have some atypical symptoms that could include nausea, abdominal pain, extreme fatigue. So if there's anything going on, it's a good idea to, again, get your numbers checked, come in for a routine visit, see your primary care doctor, or you can always come into a Minute Clinic. We can assess and talk about what lifestyle modifications would be best for you.
All right, no better time than now to make your health a priority. Jenelle Digianvittorio, I was going to get it right on the second try, Minute Clinic nurse practitioner. We appreciate your insight, your expertise, and all of your help navigating this very, very important issue. Thank you so much.
Thank you so much. Have a nice day.
You too.